Greetings, our case today on rounds involves a 24-year-old pregnant woman infected with HIV who has never been on antiretroviral therapy before. We've diagnosed her primary problem as her pregnancy and HIV. We're recommending complete prenatal vitamins, including folate and ferrous sulfate for pregnancy health. We also recommend HIV and genotypic drug resistance testing for the patient before initiating therapy. We are going to then use HART, highly active antiretroviral therapy, and combination antiretroviral therapy with 2 nucleoside reverse transcriptase inhibitors and 1 protease inhibitor. We're going to prescribe for this patient, or we would like to recommend tenofovir 300 milligrams and tricidamine 200 milligrams, which is Truvada, 1 tablet once daily with or without food. It should be noted that M-tricidamine can cause hyperpigmentation of pollens in the soles, headache, diarrhea, or nausea. We're also going to add darunavir 800 milligrams, and that's ritonavir boosted, so 100 milligrams of ritonavir. 1 tablet twice daily with food in pregnancy. This medication may cause nausea, vomiting, diarrhea, numbness, tingling, hepatitis, anesthesia, or altered taste. For the infant, 6 weeks after it's born, we will treat with zidovudine. We should make sure we understand the monitoring for this patient, so we'll need to do an HIV RNA screen at 2 to 4 weeks after initiating therapy, and then monthly until it's undetectable. After that, every 3 months, and we will specifically need to do 1 test at 34 to 36 weeks to inform the mode of delivery. We're going to check CD4 every 3 months, glucose screening at baseline and at 24 to 28 weeks, drug side effect monitoring, including liver function tests at baseline, including bilirubin, and then every 3 months thereafter, CBC with differential at baseline every 3 months and thereafter, fasting lipid profile at baseline and every 3 months thereafter, Chem7 at baseline and every 3 months at baseline and every 3 months after, creatinine clearance at baseline and as clinically necessary, and urinalysis certainly at baseline. We're seeing that her second problem is tobacco and alcohol cessation. It's definitely very important to explain to this patient the many reasons and benefits that they will obtain from cessating from these 2 substances for both her and the fetus. She should seek counseling for both of these addictions and abstain from them as much as physically possible during the pregnancy, recommending she be placed on a non-nicotine replacement therapy and perhaps anti-abuse as well to deter alcohol usage. Her tertiary problem, you would say, is opioid addiction, and we're rating that problem as controlled at this time. She will remain on methadone likely for the course of this pregnancy. Thank you.